My metaphor for teaching is bird watching, which is another practice that I'm involved in and that I have developed over time. When I first started as a bird watcher, I would be very frustrated with looking for field marks, and the birds fly so quickly, and they're in your binoculars 1 second, and you can't really nail any field marks on them. And then as I got more skilled in what I was doing, I kind of was able to let go of the field marks a little bit and say, the way this bird is acting looks like this particular species. And so just that progression of skill, I feel like that's how I've progressed as a teacher, where I have been very meticulously attached to an outline and putting in the content and making sure I teach very much like I was taught. And then sort of being able to loosen up and feel like, well, let's just see what happens here. Let's see who shows up when I'm out in the field birding. I kind of don't have any expectations necessarily. I'm just out there and I think, well, who's going to show up today? And then also you have to, I feel like I have to slow down in order to be a good birder, and I have to be quiet in order to be a good birder. And I feel like that's very much like being a good teacher, being able to slow down when I'm in the classroom with students and say, wait a minute, let's think about this. I'm not sure I understand what you're saying. And to slow down and be quiet and listen and let the students show up for what they are. Let the students' ways of being and ways of interacting and ways of thinking, let that show up by not sort of talking over it or missing it, just walking through it without looking and without slowing down.
Lisa Day is a quiet, reserved person. She's an astute listener who offers thoughtful questions and then clarifies and extends the answers that students give. In her classes and in clinical, students are actively engaged. She sets a tone that is at once concerned, serious, but also comfortable and accepting of exploration.
It definitely mimics some of the situations as a student on the floor, because, I can see these things and I have questions and I want to engage. But it's frustrating there because sometimes, I feel like I'm right, but other times I'm like, oh man, I'm just going to keep my mouth shut because I don't want to make a mistake.
Yeah.
But so it creates those same feelings. It builds confidence sometimes, and then other times.
Yeah. Sends you back to the books, maybe.
Oh, yeah.
Does it motivate you to fill in?
It definitely motivates me because I don't want to be in a situation that I don't necessarily know what to do. And so I enjoy that in a classroom setting.
They know a lot more, they grasp a lot more of the practice than they even give themselves credit for.
Right.
Because they were saying, oh, I don't know anything about the ICU.
Right.
And yet, when we were talking about concerns for the patient, they were right on about so much of it. And they had sort of the beginnings of these connections that that I was trying to pull out of them.
I like this format because I like the way diseases and processes and pathologies are all tied in a sort of a real life experience rather than just listing, this is what atelectasis is, this is what ARDS is, and just sort of thinking about them as sectioned and separate. But the flow, I appreciate that, that the sort of reality of each of these, that's helpful for me.
What does the practice demand? And what I'm trying to help the students engage with is exactly that, the demands of their practice. This is the practice that you've chosen to enter, and this is what it will demand of you, is to think, is to acquire these bits of knowledge and data and information and apply them to a particular patient. And so that's what I'm trying to do, is to help them. Okay, so I give a mini lecture on sepsis, and we look at the balance, the biochemical cascades that are going on and that are disrupted in the septic patient. And then I always want to turn to them and say, so what does this mean for our patient? So how is this going to manifest itself in the symptoms or signs that you see, and how does it generate concerns within you to respond in particular ways to this patient? So always giving them that this is the center of our practice, is what are we going to do to help this patient?
It makes you think about a patient in a comprehensive way. You're not worrying about, we can talk about respiratory, we can talk about cardiac, we can talk about kidney, but it puts it, you're worried about it, all of it.
It's integrated,
in one patient, and that's how you have to think. You have to worry about every system, and so for me, these are a little tough if I'm having an off day. It's a ton of information to synthesize. Like, oh, I forgot that he was on oxygen and it was 92%, or, you know, so you, you kind of have to really focus, but that's what you have to do on the floor, and that's, you know, I think that's what I appreciate the most about this, is it's very comprehensive, and it's the way we should be thinking, and we should be thinking about future things that we're worried about too, that aren't necessarily happening now, but, you know, constantly thinking ahead.
My own sort of path in teaching has sort of followed this idea of knowledge development in practice. What am I trying to accomplish with my teaching? I mean, I think that's such an important question.
It was a little reminiscent of some of my favorite clinical experiences where I was one-on-one with a clinical instructor who was asking me questions that really forced me to really think a little bit further than the immediate situation.
Packing all the content and then giving a lecture, and then my interaction with students would be me asking them a question and them answering the question, and then we move on. And what I realized, what I was really accomplishing with that kind of teaching is getting them really good at taking multiple choice tests.
Right.
And I thought, wait a minute, that's not really what I want to accomplish here. I want them to be good nurses.
Right.
You don't have to choose between getting an A and learning how to be a nurse.
Yeah.
And that's a
good.
problem.
Yeah.
And
That's a bad choice, isn't it?
That's a really good way to put it.
Have you changed the way you assess students using this approach?
Yeah, that's a really good question. I mean, this is sort of the cutting edge of my teaching at this point. Yeah, my own development is thinking, well, multiple choice test questions work okay, right? I mean, I've had success in assessing students using multiple choice tests, even though I taught the entire class based on unfolding case study. What I'm trying to accomplish with my teaching is to guide students towards developing an identity as a nurse, being able to think like a nurse, being able to respond appropriately like a nurse, prioritize like a nurse would prioritize, ask the questions a nurse would ask. And then how I'm assessing whether they've learned that or not is giving them multiple choice tests. And it doesn't quite sync up for me exactly. So I'm thinking I need to develop some other way, some other method of assessment. And I think a lot of teachers in schools of nursing are afraid to move away from multiple choice exams because the NCLEX is a big multiple choice exam that they have to get ready for. So I don't know. I'm not exactly sure. I mean, it could be that they need to drill on multiple choice exams. They need to get good at that. But that's sort of separate from me teaching them to be a good nurse.
Master's entry students at the University of California, San Francisco, consistently gave Lisa Day Teacher of the Year awards. She was noted for her ability to really help them developing their clinical imagination, their clinical judgment, and they were appreciative of her focused attention and understanding of their learning.